hand over to Alison. Thank you, Alison.
Thank you, Kate. Good morning, everybody, and thank you for joining today. I'm Alison Unsted. I'm the CEO of the City Mental Health Alliance, and I'm really pleased today that we are launching the latest research from the City Mental Health Alliance in partnership with Morgan Stanley and PwC, which explores the impact of the children's mental health crisis on parents in the workplace. Just a couple of housekeeping bits. This event, as you can probably see, is being recorded today. We are hoping to have some time at the end for a few questions. So if you do have any questions, please do put this in the Q&A function. We will not be able to monitor the chat throughout the event. So remember, Q&A function for your questions. If you would like to speak to anybody for support at any point during today's session or afterwards, then please do get in contact with Kate, who is our producer. So, moving on to our research today, we know that the children's mental health crisis is significant. We see study after study in the media headlines each day. And I have no doubt that many of you on this call will have seen, either in your professional lives or in your personal lives, hearing the anecdotal stories about this. This crisis is having a ripple effect across all of society, and not least the impact this is having on parents and carers of those children. And that is the lens in which we are exploring today: working parents. Parents who are trying to balance the day job with the practical and emotional demands of supporting children who may be experiencing symptoms of mental ill health. Last year, working again with Morgan Stanley and PwC, the Bank of England, Young Minds, the Pears Maudsley Trust and Place to Be, we launched a toolkit for parents. The toolkit was aimed at helping parents to understand good mental health and mental health difficulties in children and young people. It was to help parents to be aware of why and when difficulties can arise and what to look out for. It was to help parents to know where to look to get professional help if they were struggling. And it was also a source and signposting to further information on topics from trusted sources such as Young Minds and Place to Be. Now, we were overwhelmed with the response to the launch of the toolkit. And it's ended up actually being our most downloaded resource, with thousands of downloads from our website. And this really, for us, shone a light on the prevalence and the urgency of the issue. So our research today is asking the questions: what is the impact of the children's mental health crisis on parents? What should employers know about the impact? And importantly, what can employers do in response? Shortly, I'll be handing over to Farimah, our Director of Programmes, who has led this research project, to talk through some of the key insights. Following this, we will move on to a short panel discussion with Sean Maywood from PwC, Caroline Stiant from Morgan Stanley, to reflect on what businesses can do in response. Now, I'm sure some of you on the call will not be familiar with us at the City Mental Health Alliance, and I just wanted to give you a quick background on who we are. We are a membership organisation. We were set up over 10 years ago by business leaders who were committed to accelerating the journey to building mentally healthy workplaces. At City Mental Health Alliance, we see the responsibility, we see the opportunity that businesses have to support the mental health of their employees, and ultimately the opportunity to address some of the mental health challenges that we have as a society. We work with our members, we work with non-members in many ways, from running seminars to networking events with other businesses, to really share the learning, what works and what doesn't work in relation to, creating a mentally healthy workplaces. We provide guides, tools, resources. We provide an annual assessment that allows businesses to benchmark their progress against their peers and industry standards. And we also offer training to businesses to help develop the skills and confidence of employees around the topic of mental health, and most importantly, to encourage good and healthy conversations in the workplace. But finally, we are a movement for change. We identify the latest workplace mental health challenges. We work together with our members, as we are today with PwC and Morgan Stanley, to shine a light on some of these challenges that will be facing hundreds and thousands of employees. So I think on that note, I will stop there, and I'd like to hand over now to Farimah to share some of the insights from the research. Thank you, Farimah.
Thank you.
Thanks, Alison. Thank you. Lovely to be here today. And I'm really looking forward to getting this research out there. It's been a real privilege, an eye-opening privilege to work on this over the last 6 to 7 months with PwC, Morgan Stanley, and a number of charities that we work with. As Alison said, we're looking at the children's mental health crisis through the prism of how it's impacting working parents and how it's ultimately impacting the workplace as well. We're asking 2 questions. What is the scale of this impact and what is it? What should employers know about? And what support would parents like to see from employers? So how can employers help in this situation? Just to say that some of the findings are stark. Some of them are a bit upsetting, but I think it's all going to help us move forward with more knowledge and move in a positive direction. Our research for background is based on a YouGov poll of over 1,000 parents based across the UK who have children, at least one child who's aged 9 to 18 years old. And we also did qualitative interviews as well, where we spoke to a number of working parents, predominantly in the legal, professional services, insurance, and technology and financial industries. So without further ado, I'm going to go on and try and share my slides. I hope that's coming up for everyone now. Great. So let's get my slides ready. There we go. So we wanted to understand how prevalent this challenge was for working parents, how many are actually affected, and the findings are quite stark. 68% of the parents we surveyed, about over 1,000 parents, said that they'd been concerned about their children's mental health in the last 2 years. 24% said they were very concerned. That's 1 in 4 said they were very concerned. 44%, so nearly half, had concerns about the mental health of more than one child, so 2 or 3 of their children. Many are reaching out for external support. 30% had contacted a GP and 31% had contacted a counsellor or therapist. Stigma and lack of awareness is still a challenge. 13% of concerned parents had not sought external support because they didn't know where to turn. And stigma, sadly, 5% had not reached out because they were nervous about their family being judged about the situation. One quote that we had from someone that we talked to in the qualitative interviews was, from a parent, was, "I've been very worried about the mental health of 3 of my 4 children. And I know that I am not alone in this, as I've heard of similar experiences from colleagues and friends, a spectrum of concerns and fears about the mental health of our children." So I think that quote really kind of stood out to me as showing the scale of concern that is out there. And what are those concerns? Just a little bit of a look into what are parents actually concerned about in their children. So anxiety is high. Half of parents said that they had concerns about their children having anxiety. Loneliness and isolation, 48%. I would say that these are what parents have experienced and seen in their children in the last 2 years. So that will overlap with COVID, but also the aftermath of the lockdown as children have come out of lockdowns and the pandemic. Anxiety related to exams and schoolwork at 47%. And now I know that all of us personally, some longer ago than others, will have had anxiety at school and with exams, and will have seen that in our families. But one thing that when we were speaking to young minds in the process of pulling together this research is that they have noticed that for the first time, anxiety about schools and exams have entered into the top 5 concerns that parents and carers are talking about on their parents' helpline. And it is due a bit because there's a bit of a challenge in children going back into the school after the pandemic. Feelings of being left behind, feelings of struggling to integrate back. So that is something that has increased in concern for parents. 20% are worried about the children with depression, 20% disordered eating. So again, that's 1 in 5 parents are worried about that. And also you have self-harm, and really sadly, over 1 in 10 of the concerned parents that we surveyed said they're worried about their children having thoughts and ideas about suicide. 4% were concerned, if concern is even the right word, that their child had attempted suicide. So really stark and difficult stats there. I would also say it's not simple. It's not like each child has one thing they're worried about. 87% with concerns about their children's mental health reported being concerned about more than one mental health issue at a time. And if you go to the report, which we'll share the link with soon, it will also talk about other things such as difficulty sleeping, consistent low mood, but it's not as simple as one thing at a time. So it's complex and there's myriad of problems. And how is this impacting on the parents? I mean, I think it's unsurprising to say that when children struggle, at times parents will struggle too. So 60% of concerned parents said that the situation has negatively impacted their own mental health. And as one parent put it, who we spoke to, it is a stressful experience that you cannot take a break from. It's the hardest challenge I've ever had, emotional, inescapable, and relentless. And that's quite emotional and strong language. And actually the conversations that we had really brought that home to us, that this is something that takes a lot of emotional and brain space for parents. And I just want to, from an employer point of view and a business point of view, just take a step back. So we're saying that 68% of parents are saying they're concerned about their children's mental health. And then 60% of those parents are saying that they're also then having issues and having poor mental health themselves because of it. So what is happening is that, what it's saying is that there's potentially many people within our workforce who are walking around with potentially this double problem or challenge with mental health. One, that they're managing it for the children, and two, that they're managing it for themselves. And I think that's just something that employers and we as businesses must be aware of. And drilling down into thinking about what this is like for parents at work. So inevitably, we've talked about it taking up a lot of brain space, a lot of emotional energy. How is this impacting people in the workplace? Well, 65% of concerned parents said the situation had impacted them at work in some way. 24% said they're not performing their best in their job. 31% said it's harder to concentrate. 30% said it was harder to manage the stresses of the job. 19% pointed to just interruptions at work, at least on a weekly basis. 12% said that they are considering reducing their working hours to help them manage the challenge, and 8% said that they are considering leaving their job at the moment. What I would say is that we interviewed mainly, like vast majority, nearly the thousands of these parents are in work. So what we also don't know, and which I'd love to have, and I'm not sure if the stats are out there if anyone knows about it, because we interviewed working parents, they are in work. We don't know how many parents are now not in work because they left because of the challenges that our children was having. And that's a stat that I would, at some point in the future, like to get a hold of. And here are some of the quotes, and there were many, about how people felt about being in the workplace and managing the challenge at home. I felt completely overwhelmed by the situation, which makes dealing with stresses at work harder. And someone else said, I have a challenging job, which requires deep resilience. But when my resilience was low and when things weren't going well at home, it impacted my performance. At one point, I almost asked my line manager not to do my performance review, as I knew I hadn't performed what I would have wanted, and I didn't want to hear negative feedback. And one thing I would just say that came through really loudly in the qualitative interviews was that the people who I talked to, they knew their responsibilities at work and they wanted to do well. And some were even, one in particular was even thinking about a promotion they wanted to go for, but they just couldn't bring at that point everything to work in the way that they were working at that time. And they felt an intense sense of guilt sometimes, and felt a sense of guilt that they maybe were letting their teams down. And I think it's just worth noting that's also was adding another layer of stress to the parents that we were talking to, this guilt about not doing as well and being at work as they want to. This is wasn't for all, but this was for some of them, this intense level of guilt that they couldn't do as they were expected to do. Who are these impacted parents? Just a real snapshot. Well, 78% of concerned parents are aged from 35 to 54. So these people who are maybe thinking about reducing hours or potentially even leaving are potentially either in or on the cusp of management or senior roles. It's also worth noting, I think it is a gender inclusion equality issue in the workplace. Women are more likely to be affected by men. That came through quite clearly in our research. 34% of women who are concerned said it was harder to manage the stress of their job compared to 25% of men. And 16% and 11% of concerned women surveyed had considered reducing their working hours or leaving their jobs respectively, compared to 7% and 5% of concerned men. So that's just also something to note, as I know that we're also thinking about how we can support more women into more senior positions in many businesses. And look, I think this is the important stat, another important stat here. At the CMHA, we completely believe in the power of the workplace to support employees' positive mental health and keep them well. And 66% of all survey respondents said they would like support from their employer if their children were struggling with mental health and or emotional well-being issues. There is a real opportunity for the workplace to play a role here and play a positive role to support that employee and potentially their wider family. And we saw this during COVID when an enormous pressure was put on parents who had children at home, and how businesses pivoted. Many pivoted and reacted quickly and with understanding and compassion and offered practical support. And I think that businesses now have another huge opportunity to do this again for actually an issue that until now has been relatively unspoken about, but we hope will be more talked about. Just moving on to what parents would like to see. My apologies, it's quite a busy slide, but I'll just talk it through. A key thing which came through in the survey and in our interviews was flexibility, adjustments and autonomy in how they worked. They want to get the job done, they want to do it, but they like flexibility to do it around appointments they might have or the need to be at home with their child when their child needed them. Something else that came through very strongly for the interviews and in our survey was tools and resources to help understand, manage my own mental health as a parent and access mental health support myself. And in the qualitative interviews, a number of parents we talked to said that they have never thought about their own mental health and prioritizes more as they do at the point when their child is also struggling. And one gave it as an example as putting their oxygen mask on first, as you would on a plane. They cannot help their child if they are not in a good place themselves. So they are taking steps to look after their own mental health. Having healthy, open, honest conversations with line managers and colleagues really helped people from the interviews, and is clear in our survey, 24% would like to be able to talk to line managers and colleagues. And access to support for children through benefits such as EAP, counselling and medical insurance. I think, and this is another webinar on its own, and it is not what we're here to talk to today, but we know that pathways to care are difficult, can be and are difficult to navigate for parents. So if businesses are able to help children access care, that would be appreciated. Other things mentioned signposting support that would help children, and also tools and resources to help me understand and manage my children's mental health. Alison mentioned the CMHA toolkit, which we did with a number of organisations. We know that's been really helpful. And peer support is one thing that came through quite lightly on the survey, but really strongly in our qualitative interviews. The ability to talk to other parents who are going through the same thing is hugely helpful to people. And look, I just wanted to end this particular part of the webinar with this quote. The demands are intense, being there for my child, speaking to school about what's going on, securing a diagnosis, navigating the pathways for accessing care. It is hugely time and brain intensive. We rely on the flexibility and understanding of work to help me get through this. If I didn't have that, I would definitely need to leave my job. And that was from a fairly senior parent, a parent who was fairly senior in their organisation, who happily, I think the child's feeling better, but however, at the time they needed that support and understanding for their work. So that is the end of the research. But again, I guess I just wanted to end by saying, I think huge opportunities there for parents, for employers to support parents. I'm going to hand back to you, Alison.
Thank you so much, Farimah. I think those are, some quite stark statistics, in the research, and I would encourage everybody on the call to have a good read through the research report. I mean, I think from my perspective, I think we often, hear various stats. We often hear the 1 in 4 statistic, which I've always thought is quite a conservative statistic. But what we often don't hear about is the people impacted by the 1 in 4, whether that is as a parent, sibling, colleague, friend, partner. And I think this research really shines a light on this kind of hidden workplace issue that really does need to be recognised and addressed by employers, as I don't think this issue is going to go away very soon. There has been a question actually in the Q&A sort of regarding kind of pre-pandemic stats, and I don't have them necessarily to hand in terms of the impact on parents pre-pandemic, but there is a statistic from NHS Digital that the prevalence of mental ill health in young people has shifted quite significantly since 2017. At that time, in 2017, it was 1 in 9 to now 1 in 6. And yes, of course, recognise that the pandemic and the lockdowns will have exacerbated the issue at that time. But I think worryingly, there is no sort of indication that that spike is going down, which suggests this issue is here to stay. Now, I have spoken to many parents personally. I have been there myself trying to find help for my child. The health service, the educators are often the first port of call for many parents. But, as we know, these sectors are particularly overstretched and are not necessarily have the resources to offer the support that is needed. And this is really where businesses come in, and this is where businesses can help. We've seen a huge impact over the last 10 plus years from, the impact that employers have had in supporting employees with mental ill health, from efforts to raise awareness, challenge stigma, but most importantly, offer the support, and the I suppose the environment where people can open up and ask for help. And this is really our call to you as employers, is that, we believe that, businesses have the opportunity, as Farimah said, to support the parents too. Now, please do, as I said, take the opportunity, take the time to read through the report. There are lots of recommended sort of actions in there that you can take. And I know for some on this call, you may not be a large employer with, lots of resources to be able to put in place, benefits such as private medical insurance for families. And we understand that. But what I would say is there are many things that can be done as an employer to support working parents, such as raising awareness and understanding. I think offering flexibility has certainly come through in that research, as well as the opportunity for parents to connect with one another, through peer support networks, employee networks. So now I think is probably a good time to come on to our panel and to hear from 2 businesses who have been taking action to support working parents. So we have joining Farimah and I, Caroline Stiant, the Head of Human Resources for EMEA at Morgan Stanley, and Sean Maywood, who is the Mental Health First Aid Instructor at PwC. Thank you for joining us this morning. So if I can start with you, Caroline, just my first question to you is, why was it important for Morgan Stanley to be involved in this research?
Sure, thanks for having it. It's great to be able to talk about this subject. I would say there are probably 2 key reasons for our interest and involvement in this particular research. Firstly, supporting the communities in which we do business is actually one of our core values as a firm. And we honestly see the ongoing mental health issue in children as a community issue. And as you know, the destigmatisation of mental health has for many years actually been a high priority for us at Morgan Stanley. And in more recent years, we've kind of refocused our attention on the impact of children, specifically with our work through our Alliance for Children's Mental Health. We recognise there's been a lot of research into the ongoing global crisis in children's mental health and how stress, anxiety, depression, for example, is affecting young people. But the effects on parents, as you've said, particularly now in the wake of the pandemic, is less well known. So we supported this research via our alliance that I mentioned to enable data collection on the topic, really, because there has been no formal study on this topic previously. Our intention really is just to understand the issue better, so we can add to the narrative, add to the destigmatization of mental health more generally, and be able to provide our leverage to this important topic and help the broader community and how we can access help for parents and children. And then I'd say kind of secondly, obviously as an employer of parents, and in fact around 40% of our employees in the UK are parents, it's just vital for our wellbeing strategy that we recognise their needs and the challenges they face, not only at home, but as they juggle their careers here too. We prioritise creating a healthy, inclusive culture and an environment of psychological safety. And we recognise sort of physical, mental, social and financial wellbeing as being really important, and sort of supporting that of not only our employees, but their wider families. And to that end, our strategy is always kind of focused on three key pillars. We have prevention, awareness and access to resources as our sort of tenets of how we address sort of mental health more broadly. But as with most employers, core to our strategy is just attracting and retaining talent. And so it's important for us to be meaningful about our commitment to mental health. So we ensure the tone is set from the very top of our organisation. And so to that end, sort of more recently, we've established a global as well as regional wellbeing boards to demonstrate that visible support and accountability of senior leaders on this topic. Because, I mean, quite frankly, at the end of the day, a happy, healthy and supported employee is a productive employee, right? And we know that employees cannot leave their personal lives at the office door, virtual or real. It's important we recognise and support the challenges that our employees face each day. And I think this research has been pivotal in us understanding this better, not only sort of validating some of the things we've already done in this space, but really continuing to inform how we address this issue on an ongoing basis.
Yeah, no, absolutely. And I think you make a really important point there, Caroline, around the data and actually understanding, the challenge for your organisation. And I know in the case study that is in the research report, 40% of your, population in the UK are working parents, and if half of those are, dealing with, lots of issues around children's mental health, and that's quite a large proportion of people.
Absolutely.
And, the other thing I think is really key is understanding, therefore, what are the challenges and, consulting with groups within the workplace to really understand, well, what can we do to help and support? And quite frankly, this is obviously the right thing to do. We do think business plays a really important role, but you're right, this is about a healthy, thriving business. It's about making sure people do feel, able and well to do their jobs well. So no, absolutely wonderful to see the work that you're doing, Caroline. So, and thanks again for contributing your case study. So if I can move on to Sean, just a question for you. I mean, what are your sort of reflections on the findings in the research?
Yeah, I think it's very, very well described by Farimah. There's a couple that do jump out at me. The first one is the 12%, and I think it's a lot of people. This will they will resonate with this. 12% of parents concerned because their child is experiencing suicidal ideation. Now, for me, it doesn't take a lot to get into the mind of that parent. How on earth do you focus on your work if that is how your child is feeling? And there was a quote within the report as well, which isn't in the summary, but it was one that really resonated with me, where one of the qualitative interviews had produced this quote of, "I am only as happy as my unhappiest child." And as a parent myself, although my kids are now quite a bit older, I can certainly resonate with that. And so those are, if you like, a fact and a quote there that really jumped out at me from the report. I think the other percentage, if you like, that was in there that I want to hone in on is the 38% of parents receiving no support at all from work. Caroline has described why it is important for us as businesses, and it'll be similar for us. We've got 26,000 people at PwC, and it will be a similar percentage who are parents, and I'm not very good with maths, but we are talking thousands of parents who will be impacted and need that support. We have a value of care within the firm. We like to describe ourselves as tech enabled, but human led. But that 38%, I think we as businesses, we need to make sure that our people are aware. So we've got Children's Mental Health Awareness Week coming up next week, but that doesn't mean that your child is going to fall unwell during that week. It can happen later on down the line. And I know from my experience in the work that I do, and being known as a mental health first aid instructor and a mental health first aider, people will come and ask me what support there is in the firm, and we have it there, but people don't know what they don't know. And so I think with that 38%, clearly if businesses aren't providing support, I think they should look at that. And as been said, not every business is as big as ours and can offer something perhaps as comprehensive, but there are things that can be offered. But do your employees know that support is available to them? And I think we need to be unapologetic about keep reminding our staff of the support that is out there.
Yeah, no, absolutely. And I thought those statistics I found quite telling. 66% want the support, yet 38% saying they don't have it. And I think, you highlight a really important challenge actually around communication. We've seen over the course of the pandemic, organisations doing a huge amount to support, employee wellbeing, and it's almost got to a point where I suppose it's slightly overwhelmed with, resources and things that are available to them. So, I would implore any sort of organisation listening today to think about, well, what are the channels specifically for parents? It could be a parents network, it could be through certain points, life transition points where it might be maternity, shared parental leave, whatever it might be, that there are opportunities to perhaps share what resources do exist for parents, because, I know a lot of organisations do a huge amount. And the other thing just to say is just around the toolkit, because the toolkit has some really, really good advice and really, really good links to resources and information. So just purely by sharing that resource, hopefully that will support another number. Now, one of the things just on the communication, Sean, at PwC you have this kind of work and family portal. So how does that work in practice?
Get myself off mute. Yeah, so we've got our benefits site effectively, and I think now. So what we've tried to do is make everything as accessible as possible and easily accessible. So we have a global, if you like, initiative, which is Be Well, Work Well, and we have our own intranet page of Be Well, Work Well, where you can access all of the wellbeing resources that we've got right across the firm, and that does include the work and family portal, and one of the benefits that our staff can draw on is I think I'm right, it's 20 sessions now of emergency child backup care, so you can link through to our benefits page and get that help. I should say it's care, and I know we're talking about children's mental health, but actually for there will be parents on here, I'm sure. I know we're talking about businesses of the squeezed generation, where actually that backup care can extend to elderly relatives too. I know that's a slight aside, but that's a support that we have on offer.
Brilliant. Thank you, Sean. And Caroline, if I can come back to you, because I know you at Morgan Stanley are also doing a huge amount. Are there any particular examples you'd like to share today in terms of the ways in which you are supporting your sort of working parents?
Sure. We've tackled this from a number of angles. I think firstly, it's really about creating a culture of openness and honesty on the subject of mental health, kind of more generally. So, I mean, obviously we're a global financial services firm, so we can appreciate it can be a pretty high pressure environment, and that quote you read out, Farimah, kind of resonated, I think, in that respect. So creating that culture of openness is really critical. And to do this, we work closely with the business to address kind of what we see as systemic issues of health and well-being as they sort of bubble up. Morgan Stanley's global EMEA and Asia wellbeing boards that I mentioned earlier, as well as our kind of newly fledged wellbeing influencer networks, kind of operate to help shape our strategy and open up the conversation around mental health and wellbeing, and help to sponsor initiatives and really just kind of amplify communication on this subject and sort of signpost to resources. I say this wellbeing influencer network is quite new to our strategy, but we really are seeing it build to be a community of culture carriers across all divisions. And they can serve as really positive role models on health and well-being, and together with our mental health first aiders, as they really sort of work on signposting our resources. And networks, I think, are also a really important part of our infrastructure here. Morgan Stanley's family network in EMEA, for example, has about 1,600 members. And that's really important to sort of support the well-being of members. They run a sort of a topical calendar of events, again, sort of opening up that dialogue, as well as obviously sort of providing that peer support and networking opportunities to introduce parents to other parents. And, you know, sharing experiences can often be sort of a real unburdening to understand that people who look like they've, you know, really got it together at work are really all experiencing the same pressures. I think that's a very important part of the strategy. And then secondly, we've prioritised upskilling managers, and this was something that Farimah touched in the research finding as well. I mean, compassionate leadership is key to fostering that culture of openness. So to support managers and employees, we're implementing a global mental health awareness programme that we're calling Open Minds. So to provide education for managers on recognising when employees may need support. And as part of that initiative recently, we've launched what we've called the Start the Conversation Toolkit. So that really helps to signal to managers, you know, the points they should be on the lookout for to really recognise issues with their teams, and giving them helpful and kind of tangible ways to kind of start that conversation really. And then finally, but kind of, you know, as importantly, if not most importantly, really, we recognise the need for kind of flexibility and tangible support for working parents. So flexibility in the ways of working is essential when, you know, particularly when you've got family pressures and you need to be there for your children at the moments that really matter. And, you know, one benefit of the pandemic, if we can find one, is that flexibility has, you know, sort of hustled up the priorities for all employees, and we're much better at handling that dynamic now. I mean, we provide employees with both formal and informal means to ensure they feel permissioned to ask for that time for family priorities when they really need it. But we have tried to sort of address that through benefits as well, in the way that Sean has described at PwC as well. So last year we introduced and enhanced a number of benefits, including emergency backup care, as Sean described. We've introduced virtual tutoring, recognising obviously the pressure on parents and children of the sort of disrupted education over the last few years. We've introduced a paid family caregiver leave policy. You know, recognising there'll be particular points in people's careers where they just need to check out and take some time, knowing they don't have a financial pressure with that time off. And we've also introduced some co-parenting leave, which, I mean, I think consistent with the research findings, aims to promote equal parenting, enabling both parents to take time off upon the arrival of a new child, because we really feel that sets the habits of shared parenting early. You know, obviously recognising, Farimah, as you said, that women often feel a greater burden of responsibility for childcare amongst the working parenting population. And then last but not least, I will give a shout out for Headspace. Actually, this is quite pivotal to our wellbeing strategy. We introduced it in EMEA a number of years ago, actually, but it's a global benefit now, and it is really well used actually by our population. And that in particular has very targeted content for children and for parents. So that remains something that we promote widely across our employee base.
Brilliant, Caroline. Well, it's great to see. I mean, this is very much from your perspective a whole organisation approach. So obviously tackling, you know, the challenges kind of from a sort of culture, leadership perspective, and then through to kind of the interventions. And you know, it sounds like you have a very flourishing family network. So I'm sure that you know, through that, parents are getting a huge amount of support, and it's great to sort of see that level of connection. Farimah, if I can come to you now, I mean, we've obviously had some great examples from Morgan Stanley and PwC, but I mean, what do you think businesses can do to proactively, you know, support working parents? And I think it would be, you know, there's an awful lot in the research report, but I just wonder if you can pick out the sort of areas that you felt were most important.
Great. Yes, thank you. And thank you to Caroline and Sean for sharing. And I would say that there's more full case studies of what their organisations are doing at PwC and Morgan Stanley within the report itself. I think I would divide what's already been said, and a lot of good stuff has already been said, into 3 areas and 3 pillars of focus. And the first is create a culture of well-being and psychological safety within your organisation. So create an environment that destigmatizes talking about mental health challenges for all employees, and specifically action around this one. So employers can make it clear that they recognize the well-being of an employee's family as a priority, so that parents feel comfortable to ask for support and adjustments. One thing, if you read the report, you will see it comes through. We are doing a lot of work being done to challenge mental health stigma, and which is great. There is still more to be done for individuals, but there is an extra layer of stigma that exists for parents and concern about talking about it as they're talking about their child's mental health. So a bit of extra work to be done around that particular area, so people feel psychologically safe to speak up and ask for help. So it could be learning event, panel events. Children's Mental Health Week is next week. As Sean says, you know, it's an issue all year round, but perhaps use next month as an opportunity to do a lunchtime webinar, share some of this research, get in touch with us if you have any questions about how we could, you know, any suggestions we have, but maybe just do something to kind of put this on the radar as part of your wellbeing approach and strategy. So yes, first pillar is creating a culture of well-being and psychological safety, with lots of suggestions in the report for how you can do that. Secondly, develop a mentally healthy working environment for parents. So creating an environment and designing jobs and having line managers, which allows them to balance their work priorities with those at home, especially in times of urgency at home. So, you know, is there flex in the job? Can you have an understanding conversation with the line manager? Is the line manager mental health aware? That's where skills and training may come in. Increasing awareness and skills in key groups, so senior leadership as well, just so that there's the ability that people in their jobs have that autonomy, have the flexibility. That's something Caroline and Sean talked about, that they're able to support the priorities that are going on at home. So number 2, develop a mentally healthy work environment. Again, suggestions in the report for how to achieve that. And 3, and this comes back to comms, providing and signposting to accessible resources, tools and support. So we've talked a little bit today about how it can be difficult to kind of get this in front of people, but I think it's arming line managers with the information, signposting to resources that are within the business, signposting to resources that are specific to children that are outside the business. In our research report, we've got a whole page that will signpost you to places that we know are good for children and for parents that may be going through this. So it's signposting effectively to support that will help the parents and the children. The other thing I would just say in doing all of this and taking a step back is consult with parents in doing this. Please do read our research report. Please do listen to what other organisations have done, but consult the parents within your business. There's also a Bank of England case study within our report. One of the things that they did is they have a flourishing parents network. And when coming back into the workplace and designing the ways of working, they consulted with Parents Network as to what would work. And that also included, how can we support the mental health and well-being of you and your family? So in whatever you do, talk to your parents as well. The parents in your business, not your own parents, obviously. That should be clear.
Brilliant. Thank you so much, Farimah. Well, I'd just like to spend the next few minutes just looking at questions that have come through. We've had a few questions, I think probably more so for you, Farimah, so we'll come on to that in a moment. So just to say to everybody, if you do want to ask Sean or Caroline or myself a question, then please do put these in the Q&A chat, or the Q&A function rather, so we can see if we've got time to answer them today. But Farimah, just coming on to the questions, I mean, there's been a few questions, or a couple of questions around neurodiversity in children, and just whether that was something that was included in the research.
Yes, so yes, it was not included in the research. We absolutely recognise that if you're, as a child is neurodiverse, they are more likely to find themselves in situations that they will find stressful, and that will impact on mental health. And neurodiversity generally is a key focus for the City Mental Health Alliance this year. I've also seen there was a question in there about, did we look at bullying? And I think there was another question there about race. What we didn't do in this research was look into what was sitting behind the poor mental health. And I would like to, in the future, I would like to look into it. I think we just wanted a snapshot of where we are, what the impact was on working parents. But I absolutely recognise that what's the role of bullying? What, you know, how is it affecting children who are neurodiverse? These are important questions, and maybe something that we may get onto with another iteration of research, but we didn't look into the reasons behind poor mental health because it was just, it's such a huge area to go into looking at the causes that sit behind the poor mental health. But it's an excellent question, but it is not something that our research looked at.
No, thank you, Farimah. I mean, one of the things actually, the challenge around neurodiversity or neurodivergent conditions and actually getting a diagnosis was actually a topic in one of the qualitative interviews that I did with one of the parents. And I know, you know, from that conversation, you know, that the really difficult challenge in actually just getting a diagnosis. You know, and we know, obviously, as you say, that, you know, children with neurodivergent conditions are more likely to experience mental ill health symptoms. So I think it's a sort of a double challenge for parents in those situations. But as you say, obviously, it's an area of interest to us and something that we would like to look more into. Just a couple of other questions here. I mean, question from Emma around how do the stats compare to pre-pandemic? I mean, there obviously is, you know, the stats around the increase in mental ill health symptoms amongst children. But just to say, one of the drivers actually for doing this research was that there wasn't any research around the impact on parents, certainly pre-pandemic. So we can certainly see where we are now, and this will be something obviously that we'll keep an eye on going forward. Caroline, there is a question here for you around if you could provide a little bit more information on paid family caregiver leave, please. How many days do you allow for this?
Sure. So this is one of our newer benefits actually, and was implemented globally in response really to the pressures that we were seeing coming out of the pandemic, and the requirement for employees to really have some sort of I was going to say stress-free, probably not stress-free, but stress-free time away from work to focus on their other caregiving responsibilities. So that currently is a 4-week paid leave, and really formalised some kind of more informal, in the moment responses we made during the pandemic, where our response was really to, as I say, create a dialogue with our people and understand what their needs really were and respond to those in a kind of bespoke way, but recognizing really people want the comfort and the knowledge of a safety net of a benefit such as this to know that they can rely on in times of difficulty. We kind of like formalize that towards the end of the pandemic period.
Yeah, and just linked to that, there is another question come in that's linked to the leave around, you know, whether parents facing issues, I suppose, relating to children's mental health are given kind of more compassionate or more paid leave on compassionate grounds than other parents, and how do you keep employment conditions fair and equal? So I don't know, Caroline, if you can answer that question.
Yeah, and it's, you know, it's an important point to raise, to be honest, because, you know, yes, we do understand that parents are facing sort of a multitude of challenges in the workplace because of the caring dynamic, but that doesn't detract from the experiences of all employees. And, you know, and we're possibly unaware of some of the sort of dynamics that people are dealing with in their personal lives. That could be for many reasons. So So it is important that we're fair and equitable. And so the caregiver leave is really not exclusively for children, for example. It's for any kind of dependent scenario, and I say we deal with individual requirements on an employer by employee basis. I think really the most important thing is having that kind of culture where these issues can be talked about, because then we can solution for them and make sure we're supporting employees in the right way and fairly.
Yeah, brilliant, thank you. I've got one question around the event being recorded. Yes, it is, and that will be available after. I'm conscious of time, and I think if we can bring the event to a close, just want to say a huge thank you again to Morgan Stanley and PwC, and also our other partners in working or continuing to work with us around this topic. I hope the research is as well received as the toolkit. So again, would really encourage people to take the research, read through it, look at the toolkit, and I would encourage people to really share those resources with colleagues, friends, your networks, because they are incredibly helpful. I just want to also say it's really good to hear. I mean, obviously there are lots of initiatives and interventions that organisations can put into place, but I think it's great to hear this kind of whole organisation approach that we've heard from Morgan Stanley and PwC. So it's not just about putting in place initiatives, it is very much around the culture and creating a space where people can open up, can talk openly, can ask and seek a support. And then just a thought from me just on this. I mean, we've talked about why businesses are doing this, and of course, yes, it's the right thing to do. It's around having a healthy, thriving workforce. But when we think about the health of our children, we know that early intervention can be hugely helpful in long-term recovery from mental ill health. So, from my perspective, I think this is not just about the parents. I mean, these children are our future, they're the workforce of the future. And I think being able to support parents, to support the children, to get that help early, to support their recovery, is absolutely fundamental to us as a society in overcoming this crisis and, creating a healthy society for everybody. So on that point, I'd like to close the event and thank everyone for joining us this morning. Have a good day, and we'll please look on our LinkedIn, on our website for further resources from the City Mental Health Alliance. Thank you, everyone.